This is the Brabant Bulletin, brought to you by the European Brabant Registry of America, where people, passion, and preservation are our mission. Hello, fellow Brabanters. I'm Stacey Pearsall, and I am sitting here with a very special guest, Dr. Kathryn Sharbrough of the Charleston Equine Clinic. Welcome to the show.
Thank you for having me.
I've known Dr. K for quite some time, but I'm going to actually lean on you, Dr. K, for telling me a little bit about how you became a veterinarian, what drew you to the practice, and what you're doing now.
So I've been practicing for 12 years, been all equine the entire time. I actually went to school thinking I was going to do small animal kind of rural general practice, but always had grown up around horses. And as I got into it, more and more I realized I wanted to be working with horses. Took a leap, got an internship, and here I am, I guess.
Yeah. Well, there's a major national shortage on, as you said, rural veterinarians, and in particular, equine vets. Can you talk to me a little bit about why that's happening?
A lot of it comes down to, well, for equine, the lifestyle. It's a hard lifestyle. You're on the road a good bit, unless you're at like a larger practice. It can be a little isolating because not all of these practices do you have a technician with you. So a lot of times you're by yourself. And then, of course, the on-call, that's a pretty hard thing and definitely takes a lot out of you, especially if you have a family or you want children. Even if you don't, just, relationships in general, it's hard on. And of course, since you're not seeing as many patients as you can in a small animal practice, it's hard to make the same kind of money. And so then, of course, loans and cost of living these days is just hard on a lot of people. I feel like a lot of times that's why people either don't pursue it or switch. And it's kind of same story for the rural veterinarians. They face a lot of the similar problems with their field as well.
Yeah. Well, I know horse ownership, it's a great expense.
Yeah.
And oftentimes, even I will save throughout the year for those moments when I know emergencies happen. Because let's face it, every day our horses try to kill themselves.
Yeah.
I don't know why, but it's just what it is. But, given that there is such a shortage of veterinarians, and of course, we horse owners would like to maintain good relationships as horse owners, how can we improve that relationship with our veterinarians?
I think the biggest thing is, one, have that relationship. Definitely there are a good number of people that just don't ever call us until there's an emergency. We've got our regular routine clients that are using us for management and trying to avoid emergencies. So just having that relationship in the first place. And then I think the other biggest thing I'd say is just communication. We don't know which clients' budgets are, financial limitations, or how you necessarily perceive your horse, like the relationship you have. All of that then comes into your decisions of how we're going to treat, because we'll make all the recommendations, but, it's that relationship of kind of knowing that between clients and using that to then make the best decision for the horse. I would just say communicate and then having that relationship.
Yeah.
So using us for vaccines and kind of the routine stuff, because that's how we get to know you as a client and then also your horses.
When I schedule an appointment with you, I try to have my horses ready.
Yeah.
So that we're not burning up 30 minutes to 45 minutes chasing a horse with a halter around the pasture. What are some of the things that you encourage horse owners to do so that they're ready for you?
That is definitely a big one is, have your horse ready, whether that's put them in a stall, put a halter on them and let them kind of stand there tied. Because you're right, I'm not a horse trainer. And, definitely we're often running behind because of emergencies. Things take time. Or if I'm having to help you catch your horse, that pushes me back the rest of the day. Or sometimes we have to just say, hey, we can't do this. We'll have to reschedule. Unfortunately, I've still spent the time and you're going to be charged accordingly. And so definitely having your horses caught, really too, like having your horses be well behaved and working with your horses. And I think that kind of goes a little bit with the same way with farriers. Like we want to work on horses that are relatively well behaved and aren't trying to run us over or Some of that is not preventable, just depending on where the horses come from, their past. But then, and I think thankfully horse owners are very open to or understanding that sometimes we've got to sedate them to get something done for everybody's safety, not just our own, but also the owners, and then for the horse too. And so just working with your horse about being handled, especially if you have a baby, start working with them about being touched, picking up their feet, getting their temperature taken. I think that gets forgotten a lot.
Nobody likes to be probed in the back end.
No, they don't. But that's also like one of the first things we'll ask owners to do a lot if their horse isn't feeling well, and, is to, hey, what's their temperature? So just being able to do that and do it safely is nice.
Well, you cared for my stud Earl. He was in that bad accident and he was in recovery for a number of months, and he developed sort of post-traumatic stress from it. Yeah. And the minute he saw scrubs coming, he would get violent and he didn't care who was around. And I think those are one of those instances where that was uncontrollable.
Right.
Non-normal. He's a pretty well-behaved horse, but understandably was just outside of his mind. And so you actually came up with a really good approach to reconditioning him. So before you would come, 20, 30 minutes before you come, I'd sedate him. And then you would come and if needed, fully sedate him to even just draw blood.
Right.
And now he's gotten to a point where he will accept a needle without trying to put us in the ground.
Yeah.
So,
yeah.
I think also, as horse owners need to be open to taking criticism of, how things are being handled, or take advice about how to train. Listen, I'm a horse trainer and I can still use advice and I can still adapt to new ways of thinking. And that really helped him a lot. And sometimes as horse owners, you're emotional and a little too close to what's happening. So taking a step back and letting somebody else take the reins, so to speak, can sometimes make or break a situation with a horse. That's just my opinion.
And, I think some horses do better with, different people too. I mean, I have some horses that owners say, like, I'm the only one that's been able to get this done. But then I have some horses that kind of same thing. I know they do better with a little bit different technique too. So understanding what works for one horse isn't going to work for another. And sometimes it's trial and error until you can figure that part out.
I have seen on a lot of draft horse forums and on social media that some of them are skeptical in terms of they really believe that veterinarians will kind of manifest certain ailments just to get that money.
Yeah.
How do you feel when you see things like that?
That's the kind of stuff, truthfully, that just wears on you. Unfortunately, I guess I would say, like, is there the occasional vet? Maybe, but I would say that's rare and few and far between. Most of us are not. If we're making that recommendation, we have a valid concern. And that concern is mostly coming from our experience with other horses and other, our knowledge too, in that regard. Like, one of the biggest things that I feel like we're doing more of, and that's because we're recognizing it more, we're getting better at it, is both between dentistry and then the endocrine diseases. I'm making recommendations to test for Cushings earlier than, 5 years ago.
Well, for somebody, let's pause right there. For somebody who doesn't really understand Cushing's, who maybe doesn't have an older horse, what is that?
That is a endocrine disease, ends up causing a lot of problems. They have an increase in their ACTH. Big concerns with Cushing's are going to be really laminitis is kind of your major concern. And then too, they just are resistant to responding to antibiotics. They're more susceptible to infections. Weight loss and or being overweight can be some issues too.
Which I have two horses. One that we know for certain because we tested for Cushing's, who is skinnier than bones.
Yeah.
And then my other one who swings wildly the other direction, who's Miss Rotunda. And it's interesting. We just tested her, so we're waiting for those results. But I think it's really interesting. And so you said ATCH, which is a hormone essentially, right? And as you know, she had a late-term abortion last year. She's one of my European Brabant breeding mares and was unresponsive to antibiotics, which is really, really interesting because as you continue to look her over, and you're very familiar with my herd because we have a very good relationship and you see them all the time.
Right.
But you were like, we probably should look at Cushings. So for anybody who's listening and maybe some of these little boxes are being checked in your mind about something that's happening with one of your horses, talk to your veterinarian about seeing about what Cushings is. And in particular, and correct me if I'm wrong, it's for horses of a certain age.
It tends to be. I mean, before, I think we would say like anything over 20. These days, I would say anything, really over 15. And not to say that something younger couldn't have it, but I mean, we're definitely seeing early signs in these, mid-teens.
Yeah.
And I think if we can get these horses started on medication sooner, we can definitely help them a lot.
Now, the treatment for Cushing's is typically a medication called Presend. Is that right?
Presend.
Okay. And so you and I were talking because my skinny horse with Cushing's does not like to eat to begin with. Now that he has Cushing's, it's even worse. And so getting the Presend in him has been rather difficult. And so you looked up an injectable, which, for whatever reason, because of the compounding and the special way it's made, costs a heck of a lot of money. And so you talked about budget. And I love my little thoroughbred cross, and he's fun and great. And of course, I'm going to treat him as best I can because all of my horses are family. That's how I consider my horses. But looking at the bigger scheme of things, I think I will just keep on trying to put a tablet down his throat by every means necessary. But again, I think that you brought up that your veterinarian is there to discuss what your boundaries are in terms of finances.
Yeah.
And, do not avoid getting care for your horse because you're afraid of the cost.
Yeah.
I don't know about you. You see these cases all the time. Are there any situations where you think it would just be more humane to euthanize than to just let things ride?
Yes.
Yeah.
That is one of the hardest things I think I come across, is that sometimes owners, they haven't thought that far ahead because it's painful and emotional and they don't want to think about it. But being realistic, that time is going to come and you're going to have to make that decision. And truthfully, if you can't do that, you probably don't need to own an animal because, like I said, I mean, it doesn't matter if it's a horse, a dog, like any of it, it's going to happen. So be responsible and kind of think about it as much as you can in a time when it's not an emotional decision. One of the biggest questions is that I'll ask owners with like colic, when we're seeing a horse for colic, if I have any concern about, does this horse need to go to surgery, I need to know as soon as possible because I'd like to refer you because we don't have a surgical facility in our area. So we'd like to refer them as soon as possible. If that's not on the table at all, that's fine. It's going to change how I'm going to approach the situation. So, again, just communicating kind of what your feelings are and things, or what you're financially able to do, is very helpful.
Right. It's kind of funny that we're talking about end of life at the beginning of this conversation, but it's interesting to kind of work in reverse because, knowing what your limitations are financially, because let's say you've got a gaggle full of kids in the house, you have to look, am I going to forego putting food on the plates of my children
right,
for the sake of keeping my horse on the right side of the dirt? And sometimes those are really tough decisions, but weighing that out and what your financial limits are. Now, I'm not suggesting that you should go and euthanize your horse right away because I don't want to face those vet bills. Don't go get the shotgun out just yet. Talk to your vet.
Yeah. I think that's the big thing.
So let's talk about a horse's sort of midlife treatment, just routine, because you mentioned dental is now becoming much more prevalent. And I know that my horses get routine dental care.
Mm-hmm.
And over the course of having horses that have come in for training and discovering that they have never had their teeth really looked at and seeing some pretty gnarly cases, which you've looked at and referred out, talk to me a little bit about equine dental and what kind of role it's playing on the day-to-day for you.
I do dentals pretty much every day. I would recommend having your dentals, your oral exams done by an equine practitioner, a veterinarian, not just a lay dentist. Because when I'm going and looking at these horses, I'm looking at more than just their mouth. I mean, we're looking at, they get a full exam when I see them, looking at just overall health. We're talking about feeding, nutrition. So, there's a lot more going into my oral exam and teeth float than just looking at the teeth. And then too, around that middle age is when you definitely start seeing issues with their teeth, just depending on the horse, genetics, how they've been fed, what kind of care they've had as they've gotten, as they've grown up. And so just trying to decrease your risks for colic, choke, helping them to continue to maintain their weight by starting to have those routine exams. And I think the big thing too, the biggest change is we've moved away from, now the dentistry isn't just about, oh, let's go in and float the points. Well, we're going in there with a mirror and a light and we're looking for the same stuff that your dentist, a human dentist, would. And by looking and seeing these things, we're able to treat the horse earlier to help correct these problems.
Yeah. Well, I know I keep referring back to my herd, but one of the things that I noticed is that my mare was off.
Mm-hmm.
And I had tried separating her from the herd, changing her feed, giving her time, giving her pain meds, and nothing seemed to be really touching on it. And of course, well, let's have a look at her teeth. And so on a general exam, it was discovered that she had points and things. But as you said, you were looking in there with a light and mirror and it was like, yeah, something's wrong here. We should probably get the x-ray out.
Mm-hmm.
So an x-ray revealed fractures. And of course, as you said, there were, probably surgically needed to be referred out. Thankfully, we took her to Aiken, got the tooth pulled. And I will say she has been much brighter since that was healing. And so that's one thing that we've sort of eliminated from her overall well-being. So again, Brabanters, if you're listening and you've got some horses who have a little bit of malaise, or are you noticing dropping feed, or just maybe seem a little tight in the jaw, or perhaps they are pulling away from the bit, or, they're just off. Think about the teeth.
Yeah. The teeth they play a huge role. And the biggest fight back I get, the biggest reason people say is, well, they're still eating or they're not losing weight. I have seen horses with broken jaws. We had a stallion that got kicked and the top part of his jaw was literally hanging. He was still eating. They are prey animals. They're going to eat. Not to say that you can't have a tooth, something be bad enough that they do quit, but more often than not, there's some pretty serious dental pathology going on and they're still eating. So it's the little things, like very subtle signs to be looking for. And definitely it's always a great place to look when you rule out other stuff and just aren't quite finding anything. Take a look in the mouth and see what's going on.
Contrary to my thoroughbred cross, who I mentioned already, my draft horses are all very stoic.
Mm-hmm.
So making sure that I'm observing those really small behaviors, really small changes is paramount. Can you talk to me a little bit about general health and wellness? Some of the things that are common that you see. You talked about colic. What is it that you're looking for with colic? What should people be aware of? Choke, things like that.
Definitely colic's a common thing we see. It can be as severe as, they're constantly throwing themselves down, wanting to go down and roll, to just, hey, I'm not eating my food. Very mild signs. Like you said, some horses are extremely stoic. Those are the ones that are kind of scary. just because usually if you're not paying close attention, by the time an owner notices something, they're kind of far into it. If your horse is normally a big eater, never refuses their food, and then one day they're just not quite finishing it or a little slow to come, I mean, that, even as something as simple as that potentially could be a sign. So just knowing your horse. And then as far as choke, that's one too that's tricky. Don't ever, I have quite a few owners that even these days still want to put a hose up the horse's mouth, which please don't ever do, for the risk of them aspirating. Definitely that's an instance of just call your vet and have them come out and make sure that everything's cleared before you try and feed them or...
Well, yeah, I mean, so like the minute you suspect choking is happening, immediately take them off the feed and off the water.
Oh, definitely.
I have seen some crazy cases of choke happening between the donkeys, mules, draft horses. And it's so funny because some of them seem like, oh my gosh, this horse is literally going to die, and don't call the vet. And then as soon as the vet is called and they're on their way, the choke clears it.
Yeah.
How often, because choke is sort of traumatic to watch.
Yeah.
I mean, some are
very dramatic.
Very dramatic about it. What can owners do to kind of keep calm themselves? I'm sure a lot of what you do is counseling the owner.
Yeah.
So what are some tips?
I think the big thing is remember that it's not a blockage of their airway like it is, a lot of people like with us. They have a blockage in their esophagus. So, I mean, they're able to breathe. The biggest thing really is just keeping the horse calm. And if you're right that a lot of times if you can get the horse to calm down and relax, then quite often they can pass it themselves and kind of work it down. I think a lot of that depends on why did they choke in the first place, but anything you can give them or just separate them from the herd. We will have owners give Banamine orally, definitely, because it does seem to help in those situations, just to help relax them. Occasionally, if the owners have like some ACE promazine on hand and they're comfortable giving like injections in the muscle, definitely that's something else we can do to give the horse while we're either en route or kind of talking with the owners, deciding, do we need to come?
So you're talking about sedation?
Mm-hmm.
Yeah.
Yeah.
Could you give Dorm?
If you had it, yeah. The hard part with the sedation is not every owner's comfortable giving injections.
Okay.
And that I think is just dependent on the owner. Some of them don't like handling needles, and that's fine. So
what are some of those critical things that horse owners should really keep in their cabinet for those moments?
Definitely having Banamine. I mean, I feel like I want every horse owner to have at least some Banamine on hand for emergencies. And
Banamine can be given orally.
Yes.
Yeah.
So typically it's a paste, or you can get it as a liquid, which then can give orally, or if you're comfortable, can give it in the vein. If you
But don't put it in the muscle.
Correct. Do not put it in the muscle. You'll get a clostridial myositis, which is a very, very severe infection in the muscle, and that's can be life-threatening. So don't ever give it in the muscle.
Banamine in the mouth.
Yes.
So if somebody is inclined to have sedation on hand, there is also Dorm gel, right?
There is. Yep.
And that can be given orally.
Yep.
But you can also get the liquid form that would be administered via muscle. So Dorm gel in the mouth.
Dorm gel in the mouth.
And then Dorm
injectable into the muscle.
Cool. So Banamine and having some sedation on hand. Really good. What other things do we think about?
Those would really be kind of like the mainstays. I mean, I don't know that you'd have to have much more on hand necessarily. Maybe some bute. Definitely we like to use that, I feel like, a lot if we suspect like an abscess or, your horse comes up suddenly lame for some reason.
What about like a triple antibiotic or anything like that?
Yeah. I mean, definitely any kind of antibiotic salve. I feel like everyone's going to each, veterinarian has their own little favorite that they like. Personally, I like the SSD or the Ascend. It's the silver sulfadiazine, little white cream. That one's, I think, a really just good all-round antibiotic cream. But yeah, I mean, truthfully, even just Neosporin is a good, just have some of that around. And then definitely especially if you have some routine eye things, just having some ophthalmic triple antibiotic is a good one to have on hand too.
Well, we live in hurricane country, and the hay flies pretty hard here. And I've had cases where my horses have been speared in the eye by hay.
Yeah.
So I think I have 3 tubes of that kind of antibiotic.
Yeah.
So we've kind of covered maybe some like what would be emergent type of care, but let's talk about routine care. We mentioned at the top about vaccinations.
Mm-hmm.
What types of vaccines are the kind that you don't want to miss as a horse owner?
Definitely any of the ones that are what we call in the core. So that would be your Eastern, Midwestern encephalitis, your West Nile virus, tetanus, and then definitely rabies as well. But especially around here, all those that mosquito-borne diseases can cause pretty significant neurologic disease. And then, unfortunately, with your encephalitis ones, those can definitely lead to death. So definitely want to cover for those. In this area, we never actually get cold. So the mosquitoes are here year round. I mean, we had them in January. So we do vaccinate for that more frequently than other parts of the country. And so just knowing that too, and talking with your vet, if you're moving around in different parts of the country, just finding out the differences, when to vaccinate. Too, the other thing I'd say with that, in like the Northeast, they vaccinate more for Potomac horse fever, whereas we don't vaccinate for that at all down in the Southeast. I mean, we just don't have it here. And then getting with your veterinarian to know which vaccines are very important depending on where you are. But those are going to be the mainstay at least once a year, if not more frequently.
Yeah. Now, you also did equine reproduction, which as a general care practitioner now, you still do a lot of reproduction. So I know you helped me here on the farm with reproduction. So for folks who are maybe already into breeding, or people who are looking to breed their mare for the first time this season, what kind of things should they be thinking about in terms of supportive veterinary care?
One, I mean, your mare needs to be healthy. She needs to be in a good body condition. Definitely want her vaccinated. The last thing you want to do is go through all the time of breeding her and try and have her in foal to have something happen because you aren't doing just kind of routine management, with the vaccines, just good nutrition, deworming, things like that. So,
well, speaking of deworming, for a general horse owner, there's year-round worming kits that you can get. And I see a lot of eye rolling happening there. I tend to do a fecal analysis and kind of get a general census of my herd of where everybody's at and worm accordingly, which is what is sort of prescribed today, knowing that horses can become resistant, or not horses themselves, but the parasite.
Right.
So what are you recommending now? What's the protocols that you're recommending to horse owners?
I mean, definitely a fecal once a year at least. And then we've kind of make recommendations based on what those levels are. The biggest thing I'd say is that fecal, you don't want to check it right after you've dewormed your horse, because that's not going to give you a truly accurate number of kind of what they have. And so ideally you're wanting to check them kind of right before you need to deworm them. And just depending on your horse, your situation, anywhere from twice a year to 4 times a year is kind of what we're tend to recommend. They really don't need deworming more frequently than that unless they're a baby. So anything less than 2 years old, we tend to deworm a little more frequently just because they're still building that immune system. But otherwise, they tend to not need deworming more than 4 times a year.
Are there any conditions that you see specific to draft horses that you could talk about?
I mean, definitely the biggest one is CPL. Definitely that's probably the biggest thing, I feel like, or most common one we see.
And that's across breeds?
Yeah. I mean, definitely, seen it, and we've seen it a lot in the Percherons. There are a lot of Percherons being used for the carriage industry here in South Carolina. And then, even some of, the Clydesdales, I feel like have a hard time here. They tend to have anhydrosis is another kind of big one we see with the draft horses.
Oh, I had Spanish all summer because of anhydrosis. And I was told that anhydrosis really can affect horses here in the South because they have such a large surface area to try and cool, try and sweat, and then their system just shuts down. So, 1AC is one thing on the market. And I think there are several other companies who are sort of developing supplements for anhydrosis, but nothing seems to be a good hose down and a fan for mine horses.
Yeah, unfortunately, there's not a great cure for that. And, there's been a lot of anecdotal evidence that like acupuncture can help a good bit too. And definitely some herbs and, that kind of treatment. But you're right, in the end, kind of while you're working on all of that, the hose and the fan, or misters and a fan, can make a big difference.
So anhydrosis, CPL, was there any other things that draft horses might be a little more prone to?
Like you said, the PSSM, definitely see that a good bit with them. And so just managing, and then, I guess I would say like metabolic issues as far as like insulin resistance. And we definitely see a good bit of that with them as well.
The EBRA hosted a clinic over last summer with Dr. Beth Valentine, who really specialized in sort of muscle disorders and was one of the veterinarians who's early on part of that discovery of PSSM. EPSM is what she called it, but and metabolic disorder, in which she kind of throws them a little bit together. But she was talking about draft horses had evolved to have these metabolic, what we would see as metabolic disorders.
Right.
But they evolved to do that because they were working in the fields all the time and weren't eating all the time. And what food they were eating was pretty lousy.
Yeah.
But now they have an abundance of food. And so they look like fat ticks sitting out there, which presents a lot of problems. So for any of you draft horse owners who are listening, please check out Dr. Beth Valentine's. We have her information on a blog on our website. We also have her information from the clinic on the members portal. You can watch the whole clinic. And we publicly posted her diet recommendations, which is simple. Feed hay, lots of forage, lots of exercise, and add fat. That's what she said. Go to the Walmart, get yourself some soy oil, and give it to them as much as they can tolerate.
Yeah.
So metabolic problems. What other ways, aside from adding fat, are you seeing help? Nothing too effective outside of just exercise.
The biggest thing is, exercise, and then limit in this area, kind of limiting what they're taking in. And it's that balance of you want good quality while also watching calories. So
grazing muzzles might be a good alternative. Letting your pastures grow a little taller.
Yeah. Longer grass.
I know we all want to have beautifully manicured pastures and well mowed, but oftentimes that shorter grass contains more sugar. And more sugar for our metabolic horses is not a good thing.
Yeah.
So limiting that, letting them grow a little taller, let them get a little wild, and then check your horse for ticks.
Yeah. Because that comes up next.
Oh, awesome. So is there anything that you see with working draft horses? I know you see a lot of the horses working the industry downtown in the carriage company. Any sort of physically working injuries, things like that we may be looking out for?
Any kind of nerve damage, muscle atrophy, like where you have just ill-fitting equipment, making sure everything is fitting properly. And that even will go a little bit back to even your riding horses, making sure your saddle fits. Saddle fit is a huge problem with lameness that we see. A lot of it can be traced back to a poor fitting saddle.
Well, and for draft horse owners, we're trying to put a light horse saddle on a draft horse. It just doesn't fit, and then it pinches and it hurts.
Yes.
Yeah, and you can cause damage.
And if you do that long enough, you'll even get some, hind leg lameness. So it can really affect them. But that, would be the big thing, is just making sure you're all your harnesses and everything fit properly.
Yeah. And here's the moment where I plug a treeless saddle.
Yeah.
For the draft horses.
For the draft horse, yeah.
Unless you can get a saddle fitter out to talk to you a little bit about what's a best fit for riding a draft horse, a saddle. Yeah, I would agree. Is maybe a treeless saddle or a bareback saddle that's, going to accommodate you. How do you tell if a horse has an ill-fitted harness? Are you just looking for like where from? How would you know? Because you can't really see bruising underneath the hair. What are you looking for?
Kind of going off of what I know with saddle fitting, and then from what I've seen with horses that have a poorly fitted harness that causes that muscle atrophy of their shoulders, I guess I'd be looking for, are there any holes, like when you have it on, are there any big spaces, gaping? Run your hand under it. Does it feel like it's pinching at any points? And then check them afterwards. Almost massage them where the harness was. Do you get any kind of reaction where they could be then starting to tense that muscle?
Mm-hmm. Well, yeah. And there's something as simple as like if you're running your hand along their shoulder and you notice their eyes are starting to blink rapidly, that's a sign of discomfort and pain. Yeah. Like I said, these draft horses are so stoic, and it's sometimes those really what would see imperceptible responses are their way of screaming, that hurts.
Yeah.
As we wrap up, because I know I've taken up a lot of your time, is there anything that we haven't really covered that you would like to add?
Have that relationship with your veterinarian. Think about realistically what you can afford, and then be open to discussing that with your veterinarian. And then also just be a little understanding and a little patient if we call and say, well, we're running behind. We had this emergency. We're stretched thin, especially in kind of these more rural areas. It takes time to get from point A to point B. So be patient and understanding that sometimes things happen. Thankfully, most horse owners understand that if we call and say, hey, we're at an emergency, if their horse was having an emergency, they would want that same other owners to be understanding too.
Yeah. Have you offered any sort of level of like telehealth? Has that been helpful? Will it save you a trip?
Yeah, I think truthfully, I feel like we've always done that.
Okay.
Truthfully, I feel like we do more of that these days. I feel like we've always done that. I guess with texting and pictures, like that part, we can do a better job. Or even like video, like being able to send videos and things like that. But definitely, we use that a good bit. A lot of times owners will send me a picture if I get a call on the weekend or at night and hey, I'm not sure, does this need stitches? Send me a picture. I'll take a look and we can hopefully get a better idea.
At least triage it a little.
Right. Yeah. Like, is this something we need to see tonight? Or we kind of talk you through something of, hey, try this. If that doesn't improve, let's see them. I mean, even back to colic, depending on, hey, if I've got 3 other calls I'm already going to see and you call me with your horse that's colicking, I mean, we're going to triage it until I can get there or until we decide for sure kind of how bad it is. Do we need to see it? Things like that. So definitely just, again, triaging it, and we'll definitely do that communication, text and pictures and all of that. Yeah. It definitely has helped as we've kind of lost veterinarians and everything.
Well, myself personally, I want to thank you for everything that you do for us here on the farm. We always need to be very, very thankful to our veterinarians because they are under an immense amount of pressure. There's so far few of them today that we should never take for granted all the things that they do, and sacrificing time away from their families for the long days that they're on call. And when your horse is sick, it's like the end of the world because it's your family, and they're seeing 10 and 12 people having meltdowns every day. And so let's give them some emotional support when we can and lift them up where we can. And so, Dr. K, I appreciate you taking the time to chat with everybody, and I hope I don't see you very soon.
Yeah.
At least not for emergencies. But for anybody who has any questions, veterinarian or otherwise, feel free to drop us a line, info@europeanbrabant.com. And until next time, remember to ride a Brabant is to fly without wings. Thanks, Dr. K.
That's fine. Thank you.